Can you describe how the digital world is transforming how things are done in the pharmachem industry?
Joe, I'll give you a couple of examples. I'm going to talk about a very simple one, patient information leaflet. We're working through NIBRT in a collaboration out of University of Limerick, seeing how we can digitize the patient information leaflet. Patient information leaflets are typically not used by the patient, they're hard to read, small print. We're seeing how we can use digital media and technology to help the patient take their medicine, use their device more effectively. And you can imagine getting to a stage with a personalized leaflet where it can take into account other medicines you're taking, potential interactions, your education, etc. Now, it's a highly regulated area, so critical to this collaboration is the work that we're engaging with key regulatory authorities.
And like the digital world, I mean, the way pharmachem's companies used to be perceived, used to be considered smokestack industries, and there was all environmental perceptions. It's becoming more of a digital type industry, no different to maybe how Google would look or any of these tech companies. Is that something you're seeing at GSK?
Yeah, absolutely. We've got a big focus on digital, analytics, informatics, and quite diverse collaborations with some of the companies that we're engaging in. For example, McLaren, using some of the analytics and informatics technology that they use to monitor performance engine in their cars, applying it to our respiratory portfolio so that we can capture real time for every device the fingerprint in our manufacturing process so the patient is assured of every dose.
And tell me, one of the things you're passionate about is education. How can Ireland best position itself in terms of ensuring we can supply the people to get the jobs in these industries? Once upon a time it was just a manufacturing world, now it's far more scientific, higher achieving academic goals. What should we do as a country to align ourselves with this industry?
I think we need to take a step back and think of developing what I would call a strategic workforce plan for Ireland. We spoke yesterday about a gap of 8,200 graduates to meet the needs of BioPharma over the next 4 to 5 years. The skills that we're looking for now are quite different. Problem solvers, people that are heavily data literate, an ability to work across biological and technology sciences. I think in creating that ecosystem or environment, we need to go back to first principles in the way science is taught at school level.
At school level, one of the problems we've seen is that fewer girls go into STEM subjects or take up STEM subjects. There may be historical reasons for not choosing the right courses. They might think they're too hard. But ultimately, in the overall tech and science industries, we need more female leadership. From your position and your perspective, what can we do to get this right?
I think first of all, we need to educate people. I mean, for me, my job is fantastic. Every day, I learn something new. I mean, there's not many jobs that you can say that about. And at the end of the day, you're helping people do more, feel better, live longer. First of all, educate on the career opportunities that are available in science. Get rid of the myths. I think we need to sex up science, make it appealing, make it a non-male dominated academic, geeky territory, and engage, really at a much earlier stage. We spoke yesterday in NIBRT about engaging with 15-year-olds. Personally, that's too late. You need to engage much earlier. And, if I look at myself, one of my biggest influences was my science teacher when I was a primary student who taught by discovery. Everything was done by assignment. And, I think within industry, we need to do more to really push female role models so that we can encourage girls into science subjects.